pleasant good morning to all of you listening here with us on Q100.7 FM for episode 2 in season 4 of the Pulse Radio Show. As always, I am always, or I should say most of the time with you, Shane Seeley, Communications Specialist at the Queen Elizabeth Hospital. And as always, we want to share with you what is happening there. It is our hospital and a part of our mandate under the 2025 to 2028 strategy, orchestrated by our CEO, Mr. Neil Clark. A part of that and a big part of that is sharing with you all of the functions of the directorates and all that we're doing to improve healthcare, the delivery of healthcare, and make healthcare and your health the center of what we do. Today, many of you may have seen the flyer. We are focusing on nursing and what that directorate has been doing over the past few months in terms of making some inroads and some adjustments along with the strategy. So we're here to share that with you, but of course we have to tell you about all of the other things that have been happening recently as well. We had a surge in our A&E recently. We spoke about A&E on last week's program and spoke about some of the improvements we've made there with the electronic registration, how we have been able to speed up things, and then coincidentally we had a surge. So I don't know if we're being tested, but we do know that there are a lot of respiratory illnesses in the air. We also know people are not following their treatment plans as far as chronic non-communicable diseases are concerned. And we also know that people are not using and going to the primary care facilities before they decide to come to accident and emergency, because a lot of these, as I'm hearing from my doctors and the medical team in the accident and emergency, can be dealt with. Some of what they're seeing can be dealt with elsewhere. So before we get into nursing this morning, and we have a esteemed panel here with us, let me speak to Dr. Anne-Marie Cruikshank, the head of A&E, who has been actively managing this surge of patients coming into the hospital with the medical teams there. Dr. Cruikshank, good to have you on, my most frequent guest. Talk to us about what's happening in accident and emergency as far as this surge is concerned.
Hi, good morning, Shane, and good morning to all the listeners. Yes, as you had rightly said, we don't know if it's a coincidence, but from Tuesday, from the 4 o'clock shift last Tuesday, we had a surge. We noted that there were at least over 40 patients waiting to be seen in the A&E. And from that time to present, we've been having high numbers coming down to the A&E. So we don't know if they've come because they want to see the new processes and what we're doing, but we are saying it is causing a strain on us because we only have a finite number of doctors, nurses, and the other members of the team, and it is putting a strain on us.
Yeah, and I mean, even with improvements, that can't determine or that cannot dictate how many people come through the doors of A&E.
Correct. We're seeing, as you rightly said, the increased respiratory tract infections. COVID is still with us. It hasn't left us. So we are getting the occasional COVID patients, and we're seeing the non-communicable diseases and the complications of those diseases coming through the door, in addition to our trauma, which is ever present with us. As you rightly said, we're encouraging patients to go to their primary care facilities and only come to us when there is that complication of the NCDs, the trauma, those sort of accidents that we can manage, because when we have all these number of patients, obviously persons, we have to see the most urgent first, and others have to wait. I'm trying to remind patients that we have the 24-hour clinic at Sir Winston Scott. It's just across the street from the A&E. We have your polyclinics in the daytimes, and some polyclinics close late, and then you have your private urgent cares facilities and your private doctors.
And you can also call the Patient Advice and Liaison Service. That's our Hospital Pals. Pals, our help desk at 536-4800. That way you can be better directed on what type of care you would need. Of course, you would explain your condition to the medical person on that line. That's our hospital pal, and they would direct you about what your next course of action should be as far as your treatment is concerned. So 536-4800, you can call from 8 in the morning. The service has been extended. Excuse me. The service has been extended to midnight during this surge, and of course, Dr. Cruikshank and her medical teams will continue to address those patients who are there on the ground, try to push them through the system. Those who can be discharged will be discharged, and we're trying to get this situation under control. Anything that you wanted to add to that, Dr. Cruikshank?
Yes, I want to tell the public, please comply with your health regulations and guidance. Take your prescribed medications. Don't let your medications run out. Go to the pharmacies, get your prescriptions on time. Keep your regular checkups with your primary physicians, be it public or private care. Keep those appointments, because they will be able to guide you and to prevent you from getting the complications of these NCDs. If you have respiratory tract infections, go to the public or private care facilities, get tested for influenza or COVID, and only if you have respiratory difficulty, i.e. difficulty breathing, etc., that you would come to the A&E, right? And any other problems, you can call your private or polyclinic doctor, you can call the PALS hotline, and we will guide you if you need to come to the A&E, because it's only so much the team can manage, because my team now are also starting to get sick and starting to be burnt out. So we could only go for a certain period of time before we too become patients. So we're asking persons to be aware of the other healthcare facilities that they can use and ask for guidance if you need to come to the A&E. We'll be more than happy to see you, to treat you depending on what your condition is.
Yeah, we'll continue to preach that message and remind our listeners about those numbers that they can call. More importantly, 536-4800. But please take Dr. Cruikshank's advice. Dr. Cruikshank, I know you have a very busy day ahead of you trying to decant the accident and emergency department. Continue the good work, and of course we will continue to keep the public updated through you. Thanks again, Dr. Cruikshank.
Thank you, Shane, and thank you too, and have a good day to everyone. Bye for now.
We appreciate that. Let me now welcome our nursing team here with me in the studio. Mr. Henderson Pinder is the Director of Nursing Services. Great to have you here with us, Mr. Pinder.
Good morning, Shane. Welcome. Thank you.
Yes, good morning. We also have ADNSQ, that's the Assistant Director of Nursing with responsibility for quality in our hospital, Andrea Scott. Good morning. How are you doing?
Good morning. I'm doing fine, and I want to say good morning to all our listeners as well.
Okay, she has a I don't want to say a small voice. She's very quiet but very powerful in her actions, and she's been doing a lot as far as pushing the baby-friendly hospital initiative. You hear a lot about that here as well. We've been celebrating Breastfeeding Month, and you've been hearing this lady's voice throughout the month, really pushing the message about how important it is for mothers out there to breastfeed for, I don't want to say as long as possible, but for up to possibly 2 years in some cases. Shermena Kirton, she's a registered nurse, also a midwife, and she has so many other titles revolving around encouraging education about breastfeeding. Shermena, great to have you back with us.
Good morning. It's good to be here.
Always good to have you. But Director, I'll let you set the tone to talk about what we've been doing in the Directorate. We have another issue to talk about too. We'll come back to that. But set the tone for us and talk about those actions that you've been taking in nursing, which are a part of the 2025 to 2028 strategy to improve care to our patients and those who use the hospital.
Thank you, Shane. As you were aware, we would have approached you late last year, to roll out our strategy. Well, the strategy is only an outline of what we plan to do. Since then, we've gone back, we've looked at setting up certain parameters, a balanced scorecard. The balanced scorecard now for us will be just a systematic way of looking at what we want to do and determining which areas are priority. And then out of that, we set up some what we call performance matrix for each department, as they can look and see what they are doing and how it's meeting a particular strategy that we have implemented. So to make it simple, we divided it into 5 areas, as we can call them. Safety, that we want to make sure that the care that we are giving out to the public is safe, meets certain standards, international and local standards. Effective, that it is doing what we expect it to do and the results that we are seeing are coming out of it. That it is responsive, and as you heard just now, our hospital is a very dynamic situation, environment, and where you can find the situation changing very quickly, and so we need to be responsive. Also, we need to be responsive to the need of the public. We need to be responsive to the need of our teams, and we have looked at collaborative agreements and arrangements between the different members of the health team to help that to happen. And the last one, it must be well led. So we as directors, we as managers of the hospital, we have taken the charge to go ahead and to lead this charge into ensuring that the hospital is the best place for persons to come receive care and the best place for persons to come and to work every day. So some of the things that we have been doing of recent, across the hospital, we have introduced what we call an expected data delivery, because many patients come to the hospital and they want to go home.
Estimated date of discharge.
At discharge. So much in the bed, baby friendly and talking and that. So they want to go home. They want to go home, and we want to have it in a more structured process. So we would, from your initial contact with the hospital, your initial assessment, we're going to be saying to you, well, you're going to be here for 5 days. So if you come on the 5th, we're going to hope to have a discharge for you on the 10th. And to do that, we've put various measures in place that help to measure each step along the way. We want to make sure that you get your care as quickly as possible. You get your diagnostics, you get your x-rays, you get your medication, you get your care, and then we can see we provide you with your medication to go home and your follow-up appointments and letters back to the clinic or back to your private doctor, and you're in and out of the hospital in a safe and efficient manner.
And that really helps us to build on our efficiency, because then we have to meet certain targets so that estimated date of discharge, we stick as close to that as possible.
Right. And these estimated dates of discharge are based on international standards for what would be a normal pathway for a patient coming into the hospital with a particular diagnosis. So notice that it is based on the diagnosis that you get, how soon we can say to you be out. So if you come in with a pneumonia, we might say we're going to treat you with antibiotics for 3 days, and in 2 days, and then we put you on oral medication. In 5 days time or 6 days time, you should be out of the hospital. So we would have done all your tests, all your follow-ups, all your letters ready, your medication is ready, and we can say to your family, you can pick up Mr. Brown on Thursday.
And we'll be showcasing a bit more about how that works. We've created a guide through a production, a video, so that we'll be sharing that on our platforms very soon. We'll tell you when, right here on the Pulse Radio Show, so that you can look out for it on our socials, on our website, and of course in traditional media as well. Just painting that picture for how this estimated date of discharge would work in the favor of our patients. Remember, you can call us here on the Pulse Radio Show, 434-1007 or 434-1070. Those are the numbers to call. You can send a WhatsApp as well to 434-1007. Another part of what we have been implementing, it really encapsulates this baby-friendly hospital initiative that you've been working so closely with the seniors in your nursing team to flesh out. Give us a brief synopsis on that, and then let's hear a bit more about what is happening on the ground from AD and SQ, and of course Nurse Kirton.
All right. In 2017, the hospital achieved its accreditation as a baby-friendly institution. We were supposed to go back in 2023 for a accreditation, but because of the activities of COVID, we were not able to do that. So at present, we are on a course for recertification, and the QH is committed to that particular drive. We want to be recertified as an institution that will be pushing baby friendly as its goal. So we're doing this because we recognize the tremendous benefit that breastfeeding has to the mother, to the child, to families, and to communities. And as we go through, you'll learn more about that. But also that the initiative will improve maternal and child health outcomes for us that are aligned with the global best practices throughout the world. So when you hear about best baby friendly, it's not just something that is happening here in Barbados or in the Caribbean. It is an international accreditation that hospitals throughout the world strive to bring into place because it increases quality, it increases efficiency, and it helps the mother, the child, and the nation in many, many ways. This is we are a World Health Organization plus UNICEF and other international agencies have combined their efforts to streamline what is done for the mother and the child while they are in any hospital. And it is based on a declaration that was done in 1991, around there, that helped to streamline what was happening for mother and child care throughout the world.
Indeed. Assistant Director Scott, can you help our listeners to understand what that looks like on the ground in terms of the Queen Elizabeth Hospital being a part of the drive to be a bit more baby friendly?
Okay, so just let me delve in a bit into what is Baby Friendly Hospital Initiative. Much persons might not be aware of the term. So when we speak to Baby Friendly Hospital Initiative, it is really an initiative where we encourage exclusive breastfeeding from birth up until 2 years of life. And as the director highlighted, there are many benefits to a baby being exclusively breastfed. So at the QEH, we always have mother and baby together, and we don't separate them. It is only in terms of is an illness of mother or baby, they are separated, but we encourage that early bonding. From the time the baby is delivered, it is placed onto the mother's chest where they are attached to the breast. And it is really amazing to see sometimes our midwives don't even have to place the baby to the breast. It is their natural instinct for a baby to wriggle its way and find that mother's breast and attach on to the areola. And also at the hospital, we have many posters. We're also teaching our parents, not only the mothers, also the fathers, the extended family, about the many benefits of breastfeeding. On the ground, we're also going through our staff and we're reinforcing the importance of breastfeeding, not only to the staff in the maternity area, but to the staff in other areas of the hospital, so that all our staff are aware that we are a baby-friendly hospital initiative where we push and we advocate for exclusive breastfeeding. We also have in our antenatal clinic, we have a midwife-led clinic where well patients come to the hospital and they're seen exclusively by our midwives. And we have sessions going on Wednesdays. Any mother, anyone who have any concerns, any questions, they can call the antenatal clinic and get answers. And these sessions are very, very interactive. It was a recent initiative, and we are seeing that these sessions are growing. And the women, their families, they really want information and knowledge about breastfeeding.
And that's why we're here.
Yes.
That's exactly why we're here. Shermena has been a part of that information drive. Shermena Kirton, registered nurse, midwife. You can speak about some of those other initiatives that you're connected to in terms of helping to break down this information for mothers out there, explaining to them the importance, of course, yes, Baby Friendly Hospital Initiative, but also in terms of breastfeeding, breastfeeding awareness. You've turned Breastfeeding Week into an entire month of dissemination of information through this and other platforms.
Thank you. Good morning again. So breastfeeding, where to start? Breastfeeding is beneficial, as Mr. Pinder said, not for the baby, not just for the mother, not just for society, but it's really beneficial for our nation and our environment as well. And some mummies may know the benefits. Benefits to baby may be cognitive. Babies that are breastfed 2 years or beyond, there was a research done on boys only, don't know why not girls, that said that they are more intellectually advanced if they're breastfed 2 years or over. Babies that are breastfed have less infections, so they go to the doctor less for ear infections, respiratory tract infections, and if they do get sick, they don't stay sick long. Mummies, they have a reduction in breast cancer, a reduction in ovarian cancer, a reduction in developing type 2 diabetes if they were diabetic during the pregnancy. Postpartum, once babies latch onto the breast, there is a risk of reducing bleeding, excessive bleeding after delivery, which can cause other complications and separation from the baby. Then we go to our nation. But if we have babies who are well, then we have less sick days for the parents. We have less money spent on healthcare for babies or mummies that are out. Then for the nation, breast milk is ready packed, ready available, right temperature. Have nothing to do to prepare it. Just once we have 2 breasts, and only 5% of women cannot breastfeed. So that's why it's important that the mummies starting out when they're pregnant get this antenatal education, because it's important to know what your goal is, how long you want to breastfeed. WHO pushes 6 months exclusively and then 2 years and beyond, because up to 6 months, 100% of baby's nutrition is provided from breast milk. Mommy does not have to buy formula, she does not have to add water, no mashed potato, nothing. Everything that she needs, she gets from this breast milk. So we try to push mummies, telling them the benefits, educating them, because we find that research has shown too that once mummies are antenatally educated, they breastfeed for longer. All right. So our goal with regards to BFHI and QEH and the Breastfeeding Special Interest Committee is to make sure that at discharge, we have, WHO says 50% of mothers are exclusively breastfeeding by discharge from hospital, but we want to get it up from whatever our numbers are now. I know there was recent research that came out, and the abstract has been published with regards to UE, saying that our current numbers now are 15%, down from 19% in 2012. More research needs to be done.
And this is in terms of what? Down
breastfeeding exclusive rates.
Breastfeeding exclusive rates. So you mean this is the mothers exclusively are only using breast milk for the child during the period
for 6 months.
For 6 months or more.
So it's gone down a little. I don't know if.
But 19% already is low.
Yeah, but if it gone down is a little concern.
Yeah.
But I guess on our block we're seeing a lot more older mummies who would have, gotten their career together and not necessarily want to breastfeed, and they got the younger ones who don't necessarily know what it's about. So it's all about educating, and that's why we have decided the month is better, right? And in our month we have done open day last week Tuesday. We did lecture sessions or lactation talks for our healthcare professionals on every Friday of the month, and our closing ceremony is coming up on Friday, where we're going to give some recognition for those healthcare professionals who have supported breastfeeding and some mummies who are pushing through on their breastfeeding journey.
So I know some mothers don't want to breastfeed because they feel like it would destroy their bodies. It would destroy their breasts. Is that the case?
It's not the case. Once you take care of your bodies, your body will last like anything else. If you brush your teeth well, they will last. Is
breastfeeding a part of taking care of your body?
Yes, it is. If it's beneficial to the mummy with regards to breast cancer and ovarian cancer, it's part of that.
I heard that, but I just wanted you to repeat it.
It is. But I know the thing is, people say that the breasts will get long and drag down, but position and genetics plays a role in that. So if that's going to happen to you, like it happened to your grannies, your aunties, that's going to happen to you. We're proper supportive brides. So when we're breastfeeding, you always encourage mummies to bring the baby to you. Stop trying to stretch out the breast to get to the baby.
We have a producer that seems to know a thing or two about breastfeeding. But these things are very important. and they may seem small, but all of this falls under what we are doing at the hospital under the Directorate of Nursing. It's all about that public education. Speaking about that, for those mothers who are interested in coming now to get the information and to seeing firsthand how they can breastfeed properly, how can they understand how important this is, are there sessions, are there initiatives that they can seek out through the hospital that they can get the education?
Well, we have a lot of things in the works, so you gotta listen out for those. But presently at Antenatal Clinic on Wednesdays from 10 o'clock, every 10 o'clock on Wednesdays, we have a teaching session geared towards breastfeeding. Okay? This week, I think the nurse would have told me they're going to be talking to a mother who has exclusively breastfed and had a situation where her baby was given water and became very sick to the point that if she didn't carry it to the doctor, it could have died. Okay, so if mummies want to come down and hear why you don't need to give water, because the majority of our breast milk has in water. The first set of breast milk is 89 to 99% water because it hydrates the babies. Then the second half is what keeps them full and allows them to sleep at night. Right, so it has everything. You don't have to do anything extra unless you want to pump, and then that's where the cost comes in. Buying pumps, buying bottles and storage and that kind of stuff.
And is pumping okay?
Yes, pumping is breastfeeding. Breastfeeding is giving baby breast milk for however long you're going to do it. So whether it's by the chest or by the bottle, pumping is okay.
So even with breastfeeding, you have options.
Yes.
So that is good to hear, and we will continue that education. Mr. Pinder, when you see your team working on these initiatives to get that information to the public, I mean, it must bring a good feeling because it makes your life a bit easier in terms of what we're doing as a hospital in promoting that baby-friendly hospital initiative.
Yes, and you're aware, I prefer team effort, collaboration, interoperability, and this is a good example of these things coming together, working for the patients and improving the knowledge of our staff also and the public in general. One of the things that there are many myths as it relates to breastfeeding. But I want to say that breastfeeding has a tremendous impact upon the mother, in that once you begin to breastfeed and those hormones are released, the lapse and thing that people talk about will disappear, because even the act of breastfeeding has the ability to reduce other hormones that get rid of the what we call the after baby fat that you would have accumulated. Additionally, when we think about breastfeeding, we must think about economics. No, we must talk some economics, right, Shane? And in terms of what it costs economically and the environmental advantages of just breastfeeding is tremendous for a country like Barbados. We have a ready source. You don't have to go nowhere. There's no need for cans or bottles or teats or any other thing that you might need. There's no need for pacifiers. None of this thing. And some of the monies that mothers and families spend on formula can be used then to help the families themselves. The country has if our children are well, we don't have to spend much money on insurance and health care and those things, taking care of them. So there are many benefits economically and environmentally for us as a country, and mothers initiating and sustaining breastfeeding. And we at the hospital will do all that we can do by our teams to support mothers and families who are breastfeeding.
Well, this is a good point to take a short pause. And of course, the Pulse radio show here on Q100.7, a production of the Queen Elizabeth Hospital, is being brought to you compliments MedSafe, Medical Supplies Ltd, and the Fit Stop.
For all your medical supply needs, visit MedSafe Medical Supplies Ltd. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Ltd, your trusted source for medical essentials.
Back with you here on the Pulse Radio Show. I'm Shane Shane Seeley with a croaky voice this morning, communications specialist at the hospital, here with my Director of Nursing Services, Mr. Henderson Pinder, also the Assistant Director of Nursing Services with the responsibility for quality, Andrea Scott, and Registered Nurse and Midwife, Shermena Kirton. Let's continue our discussion on why breastfeeding is so important. Mr. Pinder, you know a lot about breastfeeding though. I mean, I understand my female nurses, but as Director of Nursing, I would expect nothing less of you.
Well, I've led the campaign in the past. Also, I'm a midwife. Non-practicing, you can say, but still a midwife.
A mid-husband?
And culture, if you don't mind the words. But we are, as an institution, we encourage and we teach all of our staff. So most of our staff is geared and with the same information that we have, and can help mothers, help families to adopt this most advantageous practice.
I know SNO, not here right now, Senior Nursing Officer Marlo St. Hill is also a big part of this trust, ADNSQ, Scott.
Yes, she is. She is actually our lead on the ground at the Queen Elizabeth Hospital, and on a day-to-day basis you can see her teaching staff.
I think she has a course today.
No, that's another course she's attending.
Oh, okay.
Yes. We teach staff to ensure that they keep up their skills and that the relevant information is passed on to our staff in their practice, not only in the QEH, but we're also reaching out to the staff in the public system, in the Ministry of Health. They're coming over to the QEH to join us in some of our teaching sessions. And shortly, as mentioned before, we'll be going to various departments in the hospital. They might not be clinical, such as the lab, the laundry, sewing room, physiotherapy. Each department in the hospital will be touched as it relates to the benefits of breastfeeding, so that they can pass on this knowledge to the public and assist in any way possible.
Indeed. And of course, we will continue to share the information right here on the Pulse Radio Show, even beyond this month, because a number of initiatives continue to come out of the Nursing Directorate that we need to share with you. And of course, you can have your input here as well. Those numbers to call: 434-1007, 434-1070. So 434-1007 or 434-1070. And you can also send us a WhatsApp at 434-1007. What are some of the other initiatives under your directorate, Mr. Pinder, that are bearing fruit, that we are seeing some action as far as the strategy is concerned?
So like I said before, we had looked at the strategic plan and we've implemented some matrix, and some of them are in line with the practices that we have as nurses. So we are looking at a reduction in our falls rate, reduction in our pressure injury rate. We want to reduce medication errors to zero. We want to have never incidences. So these are all initiatives that are presently being done, monitored, and we report them on a monthly basis to our executive body. But on a weekly basis, we are also now tracking those indicators, as it were, for us to see what is really happening on the ground. Now that's a practice, but then we talk about communication and customer service. So in terms of communication, we are working hard to make sure that the right message goes out to the patient each time and their families. We're making sure that the patient is educated on whatever their health need is, whatever problem they might experience. We're gearing up, making sure that our nurses are well prepared to impart knowledge skills and their expertise to the patient, that they leave the institution better able to handle that. And once they leave the institution, those persons who are at risk for also falling through the cracks, or who we think will not continue their medication, we also have a plan in place where a team will visit them. Only hospital patients, those are hospital patients, a team will visit them to ensure that they keep they're compliant with their medication, they're doing what they are, their numbers, their blood pressure, their blood sugar, their blood pressure are all in keeping with what should be normal, and preventing them from revisiting the hospital or being readmitted. In terms of a customer care, we know that this is an area where we are always having challenges. So we definitely have instituted a plan where we are looking to make sure that each patient encounter, each experience that the patient has, is one that will affect them positively. It will also redound to what we do to the families also, so that persons are rekindle their confidence in the QEH as an institution to give help.
Yeah, we are trying our best. The team, the medical teams, especially our nursing teams, are trying our best. We do get those complaints. We always encourage people, when they have complaints, please contact the clinical risk department. And you can call through the PBX and be directed there. I will give you the numbers later on in this show. But we always try to say, call 436-6450 and have our operator transfer you to the clinical risk department. That way we can register your complaint, we can investigate, and obviously
get back to you.
Get back to you.
That's the most important.
Yeah,
get back to you.
We can respond to you, let you know what the solution would be, because it may be your question and your complaint may be around your continued care. And we've seen that a lot recently, and we have to go here in terms of our hematology clinic. And we've been trying to address those patients. We met with those patients, that was last week.
Yes, sir.
We met with them last Tuesday to explain to them what was happening with the clinic and what their treatment would look like in the coming days, weeks, and in the long term as well. We're getting some doctors coming into the clinic in very short order. In the interim, we have Dr. Gill, Mr. John Gill. He is our acting director of medical services. Would have, by request, for those patients who came to that meeting last Tuesday, those who waited around, he would have seen every one of them so that they would know what is their next course of action. And we would have shared some contact details for that clinic specifically, that those people can reach out to us so that we can explain to them, hear from them what their concern is, and then promptly address it. Since then, we've seen, for my part, I've seen one message circulating on social media speaking about, it has some misinformation, and we want to correct that here today. Let me read it very quickly. I don't know how my sister does it. I really don't. She fought cancer for years, took care of our other sister right up until her passing. Then just a few weeks ago, her home burnt to the ground. She lost everything she had worked so hard for. I thought that this was the worst it could get, but now the one doctor at the QEH who actually cared, who actually helped her, treated her, is gone. And this message says suspended due to an alleged fight. So let me say that is not true. This part is not true. The doctor in question who was administering care for the hematology clinic was not suspended due to an alleged fight. So people would see the message circulating on social media and believe this, well, all of the things, all of the points made here in this social media comment are true. I can assure you that is not true. The person who was in charge of the hematology clinic, he resigned, and he's no longer with us. And now we are making those replacements over the next few weeks, and we would have shared that with those in the hematology clinic. They're saying no other doctor is available, no treatment, no answers, no plan. So part of the plan was shared with all of those patients who would have attended that meeting in the hematology in the QEH main auditorium for those patients of the hematology clinic. We also shared it on the program last week. It was also in the news as well. And I just want, this complaint again was made on social media. We want to redirect those complaints so that we can properly address it. This would not come directly to us. Someone would have to see this and then send it to us, and then we would when you see some of the erroneous comments, it's out there already, so the damage is already done. But what we want to do is properly address those complaints coming in to the Queen Elizabeth Hospital by directing them through the Patient Advice and Liaison Service, or help desk, and through the Clinical Risk Department, so that we can investigate and find solutions. This approach, the social media approach, is not about finding solutions. It is about shaming, blaming, and pointing fingers. We at the QEH, through the strategy 2025 to 2028, we want to find solutions for everyone who seeks care at the Queen Elizabeth Hospital. We want to find the appropriate response for your treatment coming through the Queen Elizabeth Hospital. So I know these responses are sometimes emotional. We know that you want the best, in this case, for your sister through this comment that was made on social media. But please, if you can, call 436-6450 and ask to be transferred to the Clinical Risk Department so that they can respond to your complaint, investigate it, and have an appropriate solution. Something you want to add, Director?
I want to give the assurance to the public of Barbados that our aim is to ensure that we deliver high quality care at all times. This is an unfortunate situation that has arisen. It is nothing that was planned. It has always been an area of problems where we couldn't recruit the number of doctors we wanted for this particular clinic. But our aim coming out of that is that we wanted to still communicate to each patient that there is a plan for them. No patient is being left without someone to look after them, someone to continue their medication, someone to care for them. And because of what was going on and what was going wrong, we decided to have a town hall meeting for all of those patients. So all the patients and their families and their relatives could come in and hear what is the plan. Because some persons who are not in this service are out there spreading messages. Yes, it is unfortunate that the consultant had to leave. Well, this consultant seemed to be this person's relative doctor, but that did not leave them without a course of action in terms of their treatment and their continued care. So we have been looking to have the clinic serviced by other persons, other doctors in the field. We've explored locally, regionally, and internationally for other persons. We've gone outside of the region and we're planning to bring in some doctors who will help us in giving the care for the clinic. We have recruited doctors from extra-regionally now who will join us in the service. We are looking at bringing back home some Barbadians also who will help to support the service. We are looking at telemedicine to help persons with any complex cases that we might have that the team on the ground cannot handle. And we have also explored re-engaging some of those of our local consultants who are in retirement or going out. So we've explored all the possibilities. Very soon we should have consultants on the ground and support registrars in that service who will bring it back up to what we want in terms of managing the service. We've spoken to the patients, we've spoken to the relatives, we've put in place provisions for that we can continue to monitor them. They can have their prescriptions written, they can have their bloods done, they can have their bloods still read. And Dr. Gill has opened himself, because I believe added to his work as DMS, added to his other work, and now he's also
as a neurosurgeon
to see these other patients also now and ensure that their care is continued. So there's no break in the continuity of the service for our patients. It's an unfortunate situation, but we have a plan. Have plans in place and contingencies to make sure that these patients are treated, even if it means that at the hospital, we have to incur the additional costs.
Indeed. And speaking about incurring that additional cost, for those patients who are concerned if they have to go private for that care, if they would have reached out to the private sector, please also then come to us and speak to us about what you have done, and we will find a solution to that problem. Come to the Department of Medical Services. That is the Director of Medical Services, the Office of the Director of Medical Services, which is at our hospital. You just come and you'll be directed there, and you can share your experience with us, and we will appropriately address it. You are listening to the Pulse Radio Show here on Q100.7 FM, where you can get all of the information you need about the Queen Elizabeth Hospital. It's brought to you compliments MedSafe Medical Supplies.
For all your medical supply needs, visit MedSafe Medical Supplies Ltd. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Ltd., your trusted source for medical essentials.
Back with you on the Pulse Radio Show. I'm Shane Seeley, Communications Specialist. You can call us 434-1007 or 434-1070. WhatsApp 434-1007. Let's get back to the QEH being a part of the Baby Friendly Hospital initiative. Shermena, Nurse Kirton, you have been working hard this month, going on Morning Barbados, coming here on radio as well, but just sharing your knowledge about breastfeeding. What is if there's one thing that you want mothers out there to take away from the public education that we've been doing throughout the month, what would that be?
It would be, you can breastfeed. It may be, they say natural, but it's not easy. Because it starts hard doesn't mean it has to end hard. Okay? So keep at it. Reach out to the resources that you have, whether it's the QEH or other support services like BCNF. Reach out and get the help that you need. And you
BCNF?
BCNF, the Breastfeeding and Child Nutrition Foundation.
Okay. Where is that located?
At family planning offices.
Okay.
Yeah, so you can reach out to them. Reach out.
You remember when you calling these acronyms? You got to explain what are you talking about.
I apologize.
You're familiar with it, but the mothers, especially those who are still uncertain and may be, as we said before, there are a lot of myths surrounding breastfeeding. For them, just to help them clear up those misconceptions, we need to put them in the right direction.
So that is the BCNF, the Breastfeeding and Child Nutrition Foundation, whose office is in the family planning. They have an Instagram page, they have a website. So if you don't get us at antenatal clinics or call back on the wards, if you want advice and the midwives can help, then you can reach out to them as well. But there are sources out there that you can reach out to. Right? I want to encourage all the mummies to maintain your lactation. You need to at least breastfeed 8 to 12 times a day, especially in the newborn period. That does not mean every 2 hours. We are dispelling the time myth now in BFHI, so there's not a time slot. Once your baby breastfeeds 8 to 12 times in a day, we see that you will have enough milk for your baby. Okay? And it's called responsive feeding. If your baby shows you that they want to feed and they show you before they cry, and they cry they are hungry, and you can't get a hungry baby on easily. So if they show you beforehand, they start to eat their hands, eat the blanket, turning the head from side to side, feed the baby. We know that initially you may be tired, so tell your support persons, and that support is very important in breastfeeding, because if you don't have someone there, as a lot of mummies who would have visited the booth, I asked them some questions like, what allowed you to breastfeed for so long? A lot of it was support, having somebody they can call. So make sure you have a support person there. Tell them the cues. So when you're sleeping, they can wait and say, I think this baby is ready to breastfeed. Right? But if you keep at it, it is going to be beneficial for you, your baby. The bonding, having your baby looking up in your face, touching your chest, smelling you, and you touching their hands, all these psychological benefits. I have been asking some psychologists to do some research on the link between breastfeeding and delinquency or criminals, right? And they've started to think about taking it up, because I believe that probably majority of babies, the people in prison, maybe have not breastfed for long. That is my belief, but somebody will have to do research to show that
we gotta
true.
get that research
Yes.
to make that
Right.
correlation.
But yeah, so if somebody's hearing and they want to take it up, feel free to take it up. But yeah, so just breastfeed as long as you can. It's beneficial for you, your baby, and the society at large.
Indeed. ADNSQ Scott has been responsible for seeing a number of young people, infants, into this world through the maternity ward. That last takeaway for us here on this edition of the Pulse Radio Show for the public, in terms of the hospital being baby friendly, but also being more aware during this breastfeeding month.
Okay, and the takeaway, it is all about the patient experience, and it is our dearest dream, our desire, to ensure that all patients receive a positive patient experience. And there's no greater joy than to see a baby come into this world. The joy on the face of the parents and the midwives and their support. So we do all in our effort to ensure that our patients have a good patient experience. And even moving on further from the breastfeeding initiative, we're also looking out for our nurses in terms of various continuing education, that they're up to par with their skills and their competencies. So we're moving on to, we've given them training in phlebotomy with the competent IV access, and they can take bloods. We have various sensitization sessions going on where they keep their knowledge up to par, and also the in-service training sessions. We know that nursing can be stressful, is a hard field, and patients come to us not only ill physically, but they have a lot of other underlying issues and that our nurses have to deal with. And our nurses at times too can be stressed, and we too offer counseling services for our nurses. So there's a lot going on the ground and various ways to support our nurses. And our biggest celebration for our nurses is during Nurses Week, where our nurses are really, really pampered to show our appreciation for them. So as we look out for the patients, we're also looking out for our nurses.
When I see the pampering that was done this year, I was like, Shane, you have chosen the wrong profession. But I watched it, I took some photographs, and I mean, it's great to see that our nurses, who are always on their feet, working around the clock, making sure that our hospital continues to run 24/7. You are the biggest complement of our staff. We must salute you, and we must pamper you to make sure that you can continue to deliver that quality service you provide. Director Pinder, I mean, it's a great, we must salute the nursing team for sure. And I know that you want to see some other things happening in your directorate, especially having your nurses certified. We heard from Assistant Director Scott about some of the continuing education, but the nursing practitioner is something that you're looking forward to happening for a hospital as well, because with that person, with that individual, you can do a lot more in terms of care and treatment for our patients.
Of course. I want to join Ms. Scott in saying that we will find all the possible ways to reward and recognize our nurses. We know it's a hard job, and any opportunity we can get to big them up, reward them, we're going to be there doing that. In terms of their continuing education now in their practice, we have for about 20 years now been fighting to have established what we call nurse practitioners, nurse specialists, advanced nurse practices, established in Barbados, where nurses can be running clinic, nurses can do offer care to patients that is above their scope that we presently have as a registered nurse. Over the last couple of years, we have had a number of persons who have functioned in those roles. They've established their own clinics, and we're seeing patients. But a few logistic problems have arisen, and we are working through those problems to ensure that these persons can be, one, restored to their practices, properly remunerated and properly recognized in Barbados as practitioners. In terms of the nurse specialists, we have a number of posts for those nurse specialists who have completed a particular training in the particular areas, and we are more than willing to, at this time, take them and reward them for that which they have been doing. So we are working on that. But in terms of the hospital now as a baby-friendly community, what we want to do as a body, we want to continue to support breastfeeding as an initiative that the mother, family, community, and the island in general can join in. Now, yes, you are saying this, but we still have formula. And we are not saying that we are not putting those businesses out, because many people think we're putting those businesses out the island. But there's a role for them, and we have been having meetings with those organizations. They know the particular role that they play, and there are certain agreements that they agreed to, not only in Barbados, but in all countries where they're allowed to practice, in terms of how the distribution of infant formula is done. And therefore, we're working with those also, because we want to develop that team. Because there are, after a year or so, there are some challenges that some infants might face, and they have a part to play. But for all intents and purposes, 90 to 95% of our children that are born in Barbados can be successfully breastfed by mothers, and we want to support that initiative. We want to continue to train our staff. We want to continue to ensure that our publics are well aware of these. We want to encourage the men to come out and support their wives and their fiancés and such like. And then there's another school out there, those grandmothers and such like, who have in many ways gone through the same process, because infant formula was not so popular before, but they have gone through the process where they're successfully breastfed. And I don't have the research either, but when we look back at the quality of life that our people are experiencing now, and the quality of life that our foreparents experienced, they seem to have been, they experienced a better quality of life. They lived longer, they were stronger, there were less communicable diseases, there were less illnesses going around, and yet those people survive. We believe firmly that is because of successful breastfeeding, nurturing, bonding, and we also thought and think that is because of that we had a stronger society, a stronger nation. And we believe that in many ways, economically, socially, physically, that this initiative can drive quality once more. It is a quality initiative at the hospital, and we are working our best to ensure that as a quality initiative, it comes under our quality framework and it fits right in, and that we get the result that we're hoping to go forward for very soon.
Yeah, good way to wrap up today's edition, episode 2, season 4 of the Pulse radio show. Some quick takeaways. We're still seeing the surge in A&E. Please, you can call our help desk 536-4800 for advice on if you do need to come to A&E or if you can seek medical attention elsewhere. The hematology clinic, if you want more information, you can always call the PBX and ask to be transferred to the DMS's office, or you can call the patient advice and liaison service and
for any problem.
And the Queen Elizabeth Hospital is a baby-friendly hospital. We're promoting breastfeeding, and we just want you to continue to get the information right here on the Pulse Radio Show. I'm Shane Seeley on behalf of my Director of Medical Services, my Assistant Director of Medical Services, responsible for quality, not Director of Medical Services, Nursing Services, Assistant Director of Nursing Services, so many titles, and Shermena Kirton, our registered nurse and midwife. I'm Shane Seeley. We'll see you next week, this same time, where we'll be sharing a lot more right here on the Pulse Radio Show.
Brought to you with the kind compliments of MedSafe Medical Supplies.
For all all your medical supply needs, visit MedSafe Medical Supplies Ltd. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Ltd, your trusted source for medical essentials.